Hi everybody, in this video I'm going to go through the exercises that I start my patients on who have recently had a lumbar fusion. Hi everybody, welcome back to the channel. So lumbar fusion surgery is something that's done with patients who generally have back pain over a long period of time, other treatments have failed them, and they end up getting a fusion. And often this is the result of something called degenerative joint disease and or degenerative disc disease in their back. And these are basically fancy terms for arthritis in their back. So I break rehab down for this into 3 phases. And in this video, I'll go over my phase 1 exercises. So I'll go through the exercises. I'll talk about really kind of the main themes of this phase of rehab and some of the exercises you should probably avoid at this stage of recovery. Before I start, remember, click those like buttons, subscribe, leave a comment. Let me know how you're doing after your lumbar fusion. So first order of business, getting into what we call a neutral or middle position of the spine. Now this is important because it's in this neutral position that the loads on our spine, our body weight, the things we lift and carry, and our movement are most evenly and efficiently distributed. So here's how you get into that position. So first, make yourself as tall as possible. I tell my patients, pretend you're a puppet, you have a string coming out of the top of your head, the puppet master pulls the string, and you're as tall as you can be. You're probably already in that neutral position. Now, step 2, you can put your hands on your back so your fingers are on your low back muscles. Now, if you make yourself tall, you'll find that under your fingers, the muscles feel kind of squishy. They're not contracting because you're in an efficient posture. Now, if I bend forward just a little bit, if I stick my chin out just a little bit, the muscles now have to contract. I can feel that under my fingers. So this is not an efficient position. So again, I make myself tall. I can feel my back muscles are kind of squishy. They're not having to work. I'm in an efficient, neutral position. And I tell my patients pretty much as long as you're sitting or standing, you want to try to maintain that neutral position of your lumbar spine. Our first exercise is something we call abdominal bracing, a real foundational exercise to the program, and this will come into play with many future exercises in this program. So the point of this is we're trying to get back our core muscle endurance, and we're trying to do it in a way that doesn't stress the healing fusion. So first, get into an upright posture, right, that neutral spine position. Find your lower ribs on the sides, slide down until you're just over kind of the sides of your abdomen, and then try to push your fingers out. So notice I can still talk, I'm still breathing, okay, while I'm holding this contraction. Hold 10 seconds, then relax. Push out, hold 10 seconds. Again, endurance is a main key. Relax. Work up to about 10 repetitions and do that 3 or 4 times per day. And as you get better and better at it, incorporate that contraction into just your regular day as you're moving about the house. This exercise is a modification of a side plank. Now, the side plank exercise is really helpful and really targets specific muscles that are useful in our recovery after a lumbar fusion. But kind of the normal side plank is way too much to start with. So this is a modification that we can start earlier. So we're going to be standing. You'll want a countertop to your side or maybe a wall a little bit away from you, because what you're going to do is, staying straight like a plank, you're going to lean into that countertop or that wall. So notice I have a gentle lean. I'm not leaning very hard, okay, but I'm straight like a plank. I'm not sagging this way and I'm not bending that way to reach the surface. I'm straight like a plank. I'm leaning gently into the surface, and I'm going to hold that for 10 seconds. I'm going to relax, give it a few moments, and then repeat. Again, keeping straight like a plank, leaning gently into, in this case, my bench or maybe a wall. Hold 10 seconds, stop. 3 times on one side, 3 times on the other. This exercise is a modification of something we call the bird dog, which again is a staple exercise for our patients who've had a spinal fusion, but the full version is something that's more appropriate for later in recovery. This is something we can use earlier on. So imagine you're, again, leaning against a countertop, maybe the wall. I'm using the part of my bench, and you're simply going to raise up one arm and the opposite leg. Now notice I'm not lifting far. I'm going to hold this for 10 seconds and then switch. And then switch arms and legs, hold 10 seconds, switch again. Go back and forth 10 times. This next exercise is something we call a nerve mobilization, basically a gentle stretch for the sciatic nerve. And what this really does is it can decrease how irritable the sciatic nerve is. And often folks who have had a lumbar fusion have had an irritated sciatic nerve for years. This can really help. The key is move slow, keep it gentle. So you're going to extend the hurt side leg, whichever leg has had the radiating pain. So in this case, my left leg. Extend the knee, flex the ankle, and at the same time look up. I know it looks a little funky, but trust me. Then head back to upright, leg down. Leg up, flex ankle, look up. Again, keep the movement slow, keep it gentle, do about 10 repetitions. In the intro, I mentioned some of the main themes of this point of rehab that are important, and they are neutral spine, maintaining that neutral spine. Number 2, muscle endurance. Number 3, cardiovascular endurance. So that neutral spine, maintaining that upright posture in sitting and standing, and eventually when you're doing something dynamic, something practical, lifting for example. If you can set the foundation in which you can maintain that neutral spine when you're eventually doing something where you have to exert force, it's really helpful. It's very foundational. Number 2, muscle endurance. All of the exercises focus on muscle endurance. The stabilizing muscles of the spine are endurance muscles. They're not power muscles. And cardiovascular endurance. You should be walking multiple times per day for 10 plus minutes. One of the other things I mentioned in the intro is what exercises do I steer patients away from? Stretching. I really don't do much stretching in this phase of rehab unless it's really needed and a patient has kind of a unique circumstance. Remember, the spine's been fused. We don't want to torque on that. We don't want to pull on that. We want it to heal. We'll get to stretching later if needed, but I generally steer patients away from a lot of stretching at this point in their recovery. Those are the exercises I most often use with my patients who are just starting physical therapy after they've had a lumbar fusion. And again, I really stress with them that this part of the program is about getting that postural alignment, that neutral spine, getting back your core muscle endurance, and improving your cardiovascular endurance. I hope you found this video helpful. I hope it helps you get back to what you love to do. Again, like, subscribe, leave a comment, and we'll see you next time.